How you doing? My name is Malik Jones, and I'm here to talk to you about schizophrenia. That's the pathology I chose, schizophrenia. Okay, let's start with what it is. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. So schizophrenia may result in a combination of hallucinations, or delusions, and extremely disordered thinking, and also extremely disordered behavior, and that would render their daily functioning, and it could be disabling. Okay, so about the etiology of it. Okay, so some of the causes of schizophrenia is excessive dopamine, excessive serotonin, genetics, environment, birth complications, and one of the biggest triggers of schizophrenia, like a schizophrenic episode, would be stress. Stress is a big one, and also drug abuse. Okay, let's talk about the psychology of it. Schizophrenia can have major disturbances in thought, perception, emotion, and also behavior. Most people with schizophrenia, they have difficulties maintaining friendships and also romantic relationships with others. And they also have difficulties caring for oneself, so grooming and hygiene. Okay, let's talk about the physiology of it. So based on my research, a study of physiology of schizophrenia has expanded beyond just excessive dopamine now. It also includes the dysfunction of glutamate, serotonin, nicotinic, as well as physiological abnormalities such as diabetes and inflammation. So diabetes and inflammation is a big one. I talked about that in my scholarly articles also. Okay, this is to show people with schizophrenia, if you look at their brain, they have enlarged ventricles. And research suggests that that's because of the thalamus shrinking. So that's why their ventricles are so large compared to normal ones. Okay, and the temporal lobe and the tissue it's like a diminish, it's going away, it's shrinking. There's no and the tissue it's just diminished. So this leads to the disturbance with selective attention and to see what you. This leads to disturbance with selective attention to what you see or hear, persistent talking, and also emotional disturbance. So that shrinkage in the tissue leads to all that emotional disturbance, persistent talking, etc. So this is the frontal lobe activity. So they have a reduced activity in the frontal lobe compared to a normal person without schizophrenia, and that shows signs of blunted effect, have difficulty problem solving, and have impoverished thinking because of that low activity in their frontal lobe. Also, people with schizophrenia, they don't have as much gray matter, and the gray matter is shrinking and not as present as it would be in a normal brain. And researchers don't really know why yet, but yeah, that's just what it is. They have lack of gray matter. And this is just a slide to show, it's like a clearer view of the loss of the gray matter, and the lobes are really different than in a regular brain. You can see the tissue that's diminishing on the top slide. You see how in a normal brain you see all the gray matter, you see all the tissue. It looks nice and healthy. On the right side of the top one, it doesn't look as healthy. You see a big hole where the tissue should be at. You can also see the ventricles are getting larger also, so yeah. Thrive centers. I think Thrive Centers would be a good thing, and I would recommend Thrive Centers for people who deal with schizophrenia, because one of the triggers of schizophrenia is stress. And one thing the Thrive Centers talk about is like reducing the stress level. They want us to significantly reduce stress level. So if you live within those Thrive Centers, your stress will be kept to a minimum, and that would be good for a person with schizophrenia. Also, environmental factors also play a role in schizophrenia. That's why I also think Thrive Centers would be good for people with schizophrenia. Because Thrive Centers, they point out the importance in everything in your environment, where they talk about where you work at, how to set up your home to reduce your stress, what community you choose to work at. It encourages you to take vacations from work. So your environment has a lot to do with it also. And also the foods you eat and everything talks about that. So that's why I think Thrive Centers would be good for somebody with schizophrenia. Okay. Can blue zones prevent schizophrenia? I think they can to a certain extent, because based on research, some of schizophrenia is just straight genetics. So you can't really, I don't think you can do too much if it's just genetically wired to get schizophrenia. But I do think it can prevent schizophrenia in most cases, because the exact causes of schizophrenia is unknown, but research suggests it's a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop schizophrenia. So in blue zones, if people live in better environments, they live to be 100 or old age, and eat healthier foods. It's a better environment. It will keep down the stress levels. It will keep them environmental factors risk to a minimum. So it will be better treatable there in blue zones also. I think if you have schizophrenia, it's less likely to have like an episode or anything if you're living in blue zones. So yeah. Is it reversible? No, based on research, it's not reversible right now. Like there's no cure for schizophrenia, but it is manageable and it's treatable with medication and also behavior therapy, especially if it's diagnosed early and treated continuously. So it's not reversible, but I don't think it's a progressive brain disease though. It could be treatable, and although you still have schizophrenia, you can have it can get better over time if you take the right treatment and stuff like that. These are my references. And thank you. And I am dressed up. Look, I got my polo. These are my shoes. Yeah, there we go. Just want you to know I'm dressed up.